How aggressive should you be treating those people? And there's a window is that if you don't look and you just plug people's numbers into a risk calculator, which can give some idea of risk, but I'm more of the mindset of like, look at the arteries themselves. It's if you look at the arteries and there's plaque, that person's high risk, irrespective of what some little calculator says. Start treating that person more aggressively, particularly if they have a strong family history. If your grandma started having heart attacks in her 40s, maybe the family should be screened a little bit earlier and treat it more aggressively for their blood pressure or their lipids. And so treat the person who's in front of you to the best of your ability, but base it off data. If that person has plaque in their arteries, they're at higher risk of having events down the road. And maybe they're not necessarily primary prevention anymore, and they're not secondary. They're maybe like 1.5.
There's a lot of backlash against statins. Could someone reverse heart disease without an exercise alone? Let's say that they have plaque and they have a greater than 400 calcium score. Could they do it without an exercise alone?
Depends on where their lipoproteins are starting with. And that's why I say it's one risk factor. If you have a 90th percentile ApoB, for example, your ApoB is 150, is diet and exercise is going to get you down to an ApoB of 70? There's no way. It's just not going to happen.
Now, hydration isn't just about drinking Coke Zero or sugar-free Red Bull. I'm saying that for a friend. Or even drinking just more water. It's about keeping the right balance of electrolytes and fluids during life's most demanding season that matters even more than ever.